Talking about other things that could affect the baby's brain development, one is oxygen.
Right.
Yeah,
Definitely.
the brain needs to be perfused.
Right.
The baby is coming out from an environment filled with water. Takes it, his or her first breaths. What could be obstructing the airway or for proper perfusion of the brain? So you want to use a suction device, clear the system, clear the airway. Okay. Afterwards, you want oxygen, to get into the brain.
Right.
Okay.
Crucial.
Now, yes. So you hear us talk about Apgar score. Apgar score is a form of timing in the first minute. Okay. First 5 minutes. Okay. These are parameters that help, to say, oh, this child will be very intelligent in the first minute. It cries, it takes a deep breath, and all that. Okay. So, is oxygen getting to the brain? Yes. No. No. Why? You do some interventions. Yes. Is it adequate? Okay. So if the baby is pink in room air, beautiful. If the baby is grayish, do you want to give supplementary oxygen? You won't believe that in some good hospitals oxygen is lacking.
I was mentioning about this on one of our other previous episodes, and it's like that is the commonest drug being used in the Western world.
Yes.
Oxygen is it's taken for granted.
Yes.
Every hospital has to have oxygen.
Yes.
You're telling me that this is so we can even forget the primary healthcare centers and even the secondary healthcare centers.
You wouldn't even imagine.
Okay.
In hospitals where you think should be standard,
yes,
you still hear in this day and age people talk about oxygen not being in the system. No oxygen, empty cylinder.
That's another one.
Poor delivery
Yes.
of supply of oxygen. It's amazing.
So how do you try it? I know you try your best, and you've already said it. You're trying to improve the standard of care so that it's comparable with the Western world. That's a tall order, I have to say. I would say almost impossible. Well, let's not say impossible, but it's a difficult thing. How do you overcome that?
Yes, I have this mindset that impossibility doesn't exist. If it's possible, and I can say, or I can boast and say, it's easy for me because the Western world have gone far ahead of us. So what we're trying to do is to catch up. Okay, what are they doing right? How do we replicate it over here? Okay, for instance, in the case of oxygen,
Yes.
there are oxygen generators that you could put in your system and you have oxygen 24/7. You could even make some business out of it. So oxygen not being in the system should be a thing of the past. There are small devices, depending on your budget, depending on how many patients you have, from small oxygen generators up to having 1,000 beds, if you want to say that.
You can have an oxygen generator for...
Yes, and generate or prepare your own oxygen and make sure your patients always have oxygen in the system.
I mentioned that initial story about the child who had prolonged labor. The mother had prolonged labor, and eventually the child came, which was hypoxic. In fact, what was not breathing at all. I think they had to resuscitate. In that case, could oxygen have helped if, as soon as she came out, they flooded her system with oxygen? What could have been different in that case? What do you think?
Yes, oxygen could have helped, but even before delivery, the mother should have been monitored with a device called a cardiotachograph, a CTG, machine, as most doctors know it, to pick up fetal distress in labor. So when you pick it up, do you want intervention? Do you want to do a CS? Okay. If you don't want to do a CS, you want to observe more. You want to give the mother oxygen and watch. So all these are things that will help, to make sure your baby comes out healthy. Okay. So if you place the mother on oxygen, the CTG machine, improves. Says the fetal distress is reducing. Fantastic. It's not improving. Intervention. Okay, so these are clear-cut indices where medical gadgets, medical equipment comes into play and helps. It just makes the doctor's life easy.
Yes, and the patient's
or
life
easier,
is easier as well. So again, folks, it's so important that you don't. We talk about taking your health in your hands, and that's the name of the show. But in some cases, you don't take it into your own hands, especially around this very sensitive period of childbirth and labor. You've got to get the right kind of attention. You've got to get expertise, go to the right establishments, so that if in the event of anything going wrong, there's the equipment and the expertise to take care of the mother and the child, so that we don't have this huge numbers of kids coming out with severe disabilities. So please pay attention to that. We will, as we've said over and over again, some of these things might actually be small things that Dr. Okundaye is talking about, but they make such a huge progress, such a huge difference. Again, with the foundation, we see kids of different ages, and you can see most of the problems started at this time that we're talking about, at that time of birth. The right things were not attended to. People took things for granted. The experts, something just went wrong. So it's so important. Okay, what else should be in a neonatal unit, for instance? By the way, great work what you're trying to do to change things and make things, these equipment and reagents available. But I don't think, do we have good survival rates for premature births? I know that's a tough one too.
Yes, so, in the past 7 years, okay, the survival rate has improved drastically.
Really?
Yes, referring to what I was saying initially,
Yeah.
of you walk into a hospital before 7 years, before supplements started pushing gadgets like bubble CPAP and all that, and you hear stories of the survival rate is 50-50.
Yeah.
We've left that stage. Okay, so you walk into a hospital, a standard hospital, okay, with bubble CPAP, with surfactant in their pharmacy.
Yeah.
You take, the baby comes out, you apply these gadgets and put in your surfactant. The survival rate greatly improves. Yes, it greatly improves. So we are catching up with the Western world. Okay, yes. And yes, I can say that we will get there very soon. I'm optimistic.
That's fantastic.
Yeah.